blood test that finds 50 types of cancer is accurate enough to be rolled out.
Here's a summary of the article.
A simple blood test that can detect more than 50 types of cancer before any clinical signs or symptoms of the disease emerge in a person is accurate enough to be rolled out as a screening test, according to scientists. Scientists said their findings, published in the journal Annals of Oncology, show that the test accurately detects cancer often before any signs or symptoms appear, while having a very low false positive rate. The overall ability to generate a positive test result in cancers of the blood, such as lymphoma and myeloma, was 55.1%. The test correctly also identified the tissue in which the cancer was located in the body in 88.7% of cases. Dr. Eric Klein, chairman of the Glickman Urological and Kidney Institute at Cleveland Clinic in the U.S. and first author on the research, said, "Finding cancer early, when treatment is more likely to be successful, is one of the most significant opportunities we have to reduce the burden of cancer. These data suggest that, if used alongside existing screening tests, the multi-cancer detection test could have a profound impact on how cancer is detected and, ultimately, on public health." Dr. Marco Gerlinger, from the Institute of Cancer Research in London and consultant medical oncologist at the Royal Marsden NHS Foundation Trust, said, "This new study shows impressive results for a simple blood test that can detect multiple cancer types. False positives are low, which is important as this will avoid misdiagnosis. For some of the most common tumor types such as bowel or lung cancer, the test even picked up cancers that were very small, at a stage where many of them could potentially be cured." The study was done in patients whose cancer was already diagnosed based on other tests, and this screening technology still needs to be tested in actual screening trials before routine use. The results of the NHS pilot of the test, which will include 140,000 participants, are expected by 2023. Professor Peter Johnson, National NHS Clinical Director for Cancer, said, "This latest study provides further evidence that blood tests like this could help the NHS meet its ambitious target of finding 3/4 of cancers at an early stage, when they have the highest chance of cure. The data is encouraging and we are working with GRAIL on studies to see how this test will perform in clinics across the NHS, which will be starting very soon."
This post received a score of 38,000, with an upvote ratio of 96%. Here are the top comments in response to this article.
Approximately 50% sounds pretty low, room for plenty of improvement still. Low false positive rate is good though. Competition in this space from Guardant and others should continue pushing the technology forward. It'll be interesting to watch get better.
Sensitivity for stage 1 cancer is also only 17%. With that said, this is a step in the right direction and paves the way for better diagnostics in the future.
How wonderful is this? I can't even begin to imagine the possibility of lives saved by early detection. Great news this morning. Thank you. Hopefully the cost of the test is not too high and it could be rolled out to other countries for use, too. But this is good news indeed. Absolutely. Even for third world countries. Having the effects of this limited due to financial resources would definitely lessen the help this would give.
Yes, but what is the point of early detection if treatment is cost prohibitive? Edit. This comment specifically concerns the challenges of screening for disease in the developing world.
Early treatment would also cost less.
What is the shortest window from when a cell starts to mutate and becomes cancer, until it is too late to treat? Like, could you test yourself once a year to detect cancer with this, and most likely get ahead of the disease?
A year earlier, no lymph node problems, and I'd probably not have needed chemo. One of the docs said this probably started about 5 years ago. It's that slower spreading cancer. Every 5 years to start with. Budgets, studies showing the best chance to catch amount of cancers for pounds. With it being offered to some people with a higher genetic risk perhaps more often. For many problems, once a year is going to catch a whole load of issues before you yourself start to feel off.
So happy you're doing well. Best wishes for your continued health.
Hey Red Cross, do you want to exponentially increase the number of donations you receive? Offer to run a free cancer test against every donation, or even discounted, if the cost of the test is high, giving people an easy way to detect cancer early on a regular basis. It's a win-win situation.
This is a great idea and could benefit the entire planet. This is absolutely never going to happen. The Red Cross already tests your samples to make sure you're not passing along anything to the recipient. It really wouldn't be difficult to add another test.
Do you get notified of the results?
Excellent news, but I have to admit that I'd probably die from a heart attack while anxiously awaiting the results of this test.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.